Today we kind of on my KPFT show we kind of deviated into the healthcare system and different countries and how they provide healthcare. And Cici, a caller who is a native of France, called and really sort of explained how their system work and let us know that it it relieves the stress. It is deterministic, etc. Not the crapshoot that we have here in America. And of course, we know that people in all these OECD countries, like France and others, they have better lifespans than we have here. So listen to what she had to say. Let's take it on the other side. Let's go to Cici. Come on in, Cici.
Hi, how are you?
I am
I just
fine.
wanted to add a thank you. Oh, that's great to know. Um, sorry, I'm a bit nervous.
Don't wait. First of all, stop, Cici, stop. We are having a conversation. Don't ever be nervous on this show. Be nervous elsewhere, but we love all our callers, no matter where your point of view is. So have fun.
Thank you. So I wanted to add on to your perspective, and also since you were curious to know about other healthcare system, I'm originally from France, and
Mhm.
one of the most um, praised structure or infrastructure that we have in France is the healthcare system. And
Mhm.
we do have a system that is now crumbling, in fact, but it's still relying on the single payer system. Now, I, I, I'm with you when you want to defend it because what it says is basically there is a system that price everything, every procedure, every medical visit, every medication. And the government, just like you explained, subsidize it. Now, if the doctor want to have what we call out of network from the subsidized system, they can charge over that pricing. They will not be receiving the subsidized funds from the government, but we do have a private system on top of the public system. But the
Mhm.
public system have tiers depending on how much you are paying with your social security. Everything is tied. You will have a price that is based on a ticket. And for every single of those procedure or every single of those visits, you will be charged for that much. And then on top of that, because you want to be covered for those additional expenses, um, you get an insurance. So insurance is not tied to the healthcare system in the sense of you can, for instance, get to the dentist and you will have to pay extra charge on top of what is covered by the public funds. You get your insurance to cover that part. So the system is amazing. It has been working forever, and I wish and I we can imagine a way that we would have it in the U.S. because it just alleviates so much stress and so much anxiety on households thinking that they are one bill away from getting bankrupt. There is no world where America can be seen as one of the most innovative country and let their population go bankrupt for a medical bill. That doesn't make any sense. So
Cici,
I encourage,
Cece,
yeah,
we're out for time, but I am so thankful to your call because let me tell you, the only thing that works is for people who've lived it and understand it to teach us Americans that we don't have to succumb to the cronies here that makes us believe that somehow we are better than everyone else when others have gone through this, have better lifespans, have less stress, etc. So I want to thank you so kindly for calling us and informing us on this particular issue.
you're very welcome. And just one last thing, because you did mention something about the cronies. When you have one particular institution that you can point at and look at and have accountability to, it makes a difference. In France, we have what we call the court of accounting, which check every single
Th-
institution
Thank you.
expenses and spending. So yeah,
Cece,
it's
I got to go
mhm.
and thank you so kindly. Now, if we would get off the indoctrination that we have that somehow a single payer system, there's something wrong with it. Think about how many lives in America would be saved. Think about how much money in America would be saved. Think about how we could prevent those parasites in the insurance industry, the healthcare industry, the hospital industry, the drug industry, pharmaceutical industry, from ripping us off blind. We are the only country that they have the opportunity to rip us off, and that's because we have allowed our people to be dummified into believing that doing the right thing, doing the wrong thing is the right thing. We need to solve that problem. Let's make sure and work towards healthcare for all, one healthcare system that covers everybody, whether you're a veteran, an older person, a younger person, or whatever. We don't need the complexity and the evil of the system that we have today. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.